All right. Okay, so the first thing we are going to look at is what we're going to cover today. So we are going to dive into Medicare. We're going to talk about when you can enroll, what A and B are, what they cover, as well as the difference between an Advantage plan and a Medigap plan. So you might have heard one or the other term and not know what that meant. We're going to go over what that does mean. We're also going to talk about the prescription drug coverage, the little bit of extras like your dental and vision that you have now with your current company plan. So how can we keep you having coverage with them as well? And just some tips and tricks to kind of help you along your journey and way. And again, we can help you guys specifically or any of family members, friends, anyone who is having any issues with the Medicare. So first, let's talk about what Medicare is. So Medicare is a federal health insurance program. It is very often confused with Medicaid, but that is not the same. So Medicaid is based on your income, not your age. Medicare is based on your age, not your income. So they are a little bit different, but very similar. Parts A and B are known as original Medicare. That is the parts we're going to get from the government, and we're going to dive into those to see what they actually cover and what they don't, and when you can enroll. Most people enroll in Medicare when they turn 65, or they automatically get enrolled after they've been deemed disabled by Social Security after 24 months. You can also waive your Medicare coverage until you go to retire as well, which may affect some people in this group, and we'll talk about that as well. Let's talk about when to sign up for Medicare. So you have some enrollment windows in which you can sign up for Medicare A and B with the government. So there's the initial enrollment period, which is probably the most popular, which is the 3 months before your birthday month itself, and 3 months after your birthday month. You don't get auto enrolled into Medicare Part A and B unless you're collecting Social Security prior to 65. So anyone who is not collecting Social Security before 65, which is a large population of people, you are the one that is going to actually initiate signing up for your A and B of Medicare. There is just a slight thing for anyone that is in the HSA plan. You cannot enroll in either part of Medicare and still contribute and have that HSA plan. So just want to point that out just so you're aware of the rules. Anyone that was disabled, you get auto enrolled. So you, again, that's easy. You're deemed disabled. After 2 years, you'll automatically get a red, white, and blue Medicare card, and then we're able to talk about your Medicare options. The easiest way to sign up for Medicare is to do it online. So we walk you through, Team Medicare can sit and walk you through logging into your Social Security account, filling out the application. It takes all of 10 minutes to enroll in A and B online, and then you're ready to go. If you enroll in Medicare A and or B after you've turned 65, there is some paperwork that may be required, just so there's no penalties to show that you've been covered under the employer plan. But again, we show you those forms, we give them to you, we help you fill them out, we help you submit them to Social Security. So we do all of that with you together. For a lot of people who are probably on this call, what do I do if I'm still working? So once you turn 65, you do want to enroll in Part A as an apple of Medicare, unless you're a part of that HSA plan. Everyone else should enroll in Part A so that they have their information in the system for when they go to retire and want to get Part B. You can stay on your company's insurance as long as you're a full-time active employee and your company that you work for is over 20 employees, which is your situation right now. If you do stop working and go to retire, anyone that is eligible for Medicare, so anyone under 65 or anyone that has Medicare and is over 65, once you get the option of COBRA, your Medicare A and B are going to be primary to that COBRA plan. So it's very important to make sure that if you elect the COBRA, that you're also enrolling in Medicare A and B as well. There are some other eligibility periods that happen throughout the year. Most commonly are the special enrollment periods, and essentially this can happen on the first of any month. So if you have turned 65, decided to stay actively working full time, your company insurance is primary, you would have a special enrollment period to get your Medicare Part B on the first of any month that you decide. I would highly suggest anyone looking about 2 to 3 months prior to wanting to get Medicare, because the government can take anywhere from, I would say, like 4 to 8 weeks to process a Medicare application. There's also the general enrollment period. So if you missed your turning 65 initial enrollment period, you don't have any special election or special enrollment period. There is the general enrollment period, which would allow you to enroll in the A and B in the beginning of each year. When you speak to someone on Team Medicare as well, we will take you through all the timelines for the different plans that are also listed on this chart, depending on what is the best option for you. So let's dive into Medicare itself. So Part A is your hospital coverage. Essentially, the main part of having Part A is to cover you when you're in the hospital and stay overnight. Most people do not pay for Part A as long as you've worked 40 quarters or 10 years of your life. Part A is the part that you do sign up for, again, as long as you're not contributing to the HSA, when you do turn 65, and we can start up to 3 months prior to you turning 65. Part B is the other half of original Medicare from the government, and Part B is for your doctor's coverage. So this is going to cover your doctor's office visits, your doctor's surgical visits. It'll also cover testing, so CAT scans, MRIs, X-rays, lab work, as well as therapy visits. So think physical therapy, speech therapy, as well as mental health therapy. All of everything technically outside of that hospital stay that you're covered by Part A is going to be covered under Part B. Now, everyone in the country does pay a premium for Part B. And this year in 2025, the average is the $185 per person per month. And again, this is the part of Medicare you can waive until you are no longer working. Once you're covered by A and B of Medicare, there's two different types of ways that you can be covered with Medicare plans. The first way is what they call Part C. And Part C is going to be an extra policy that you are going to purchase from a private insurance company. These plans are HMO and PPO type of plans. They do take over as primary to your Medicare. So now the company that you enroll in, so say you enroll in a specific carrier, they get to now decide on what specific network of doctors and hospitals you can go to. They give you a fee schedule so you know what you're going to pay in copays, and we'll be able to check networks for hospitals, again, doctors, urgent cares, things like that, to make sure it works with who you see. Again, these plans with Part C, also called Advantage, will include extras. So you're used to having dental, vision, there's hearing benefits, sometimes gym memberships that are included in this type of plan. And Part C is medical and your prescription drug, all in one ID card. To dive in a little bit on the prescription drug plan, you can have a prescription drug plan as a part of those Advantage network plans. You can also have a plan as a standalone coverage, and this would allow you to have just a plain prescription only policy. All prescription plans are based on your zip code. So there are different plans in different areas at different prices, even if they have the same name between the different states. Every plan has its own set of drugs that they cover, and they have their own set of copays that they make you pay. What we like to do is get a list of your medications for you and your preferred pharmacies, and we actually give you a yearly budget and tell you how much everything is going to cost upfront. So you'll know before you even enroll how much each medication is going to be every time you go and pick it up at the pharmacy. So for 2025, there is a standard deductible. So deductibles on prescription drug plans are around $590. It can be less, but that's the maximum. Then what happens is you pay a percentage of your drug cost until you reach the annual maximum of $2,000. So every drug plan with Medicare throughout the country has a $2,000 annual out-of-pocket maximum. This means that once you paid $2,000 for a calendar year at a pharmacy for all of your medications, all in combination, all your drugs would be covered 100% after that $2,000. So what you want to really do is just look for the least expensive plan that covers all your drugs so that if you do hit that $2,000, you have the least amount out of pocket as you can. Just to give you a little timeline of the different changes that have been taking place that were set in 2022, this is what the Inflation Reduction Act looks like. So in 2025, that's this year, we started that $2,000 out-of-pocket maximum. Prior to that, people had to spend almost over $8,000 in order to get their medications covered 100%. In 2026 going forward, they're going to start negotiating the government on some Part D drugs, mostly injectables, brand name medications, things that are more expensive like inhalers, and start to negotiate their costs down to help people save money. The other type of plan that you could have instead of one of those Part C Advantage plans is called a supplemental. These are all the different supplemental plans that are available throughout the country, but there are very common ones. G and N are probably the most common throughout the entire country. Let's take a minute and do a side-by-side comparison on those Part C Advantage plans compared to having that Medicare supplemental. So let's go back to the Advantage. So for both plans, you have to have A and B of Medicare. If you choose an Advantage plan, that plan becomes your primary insurance. That will allow you to use their network of doctors and hospitals that they say you can use and pay the copays for each procedure that they allocate each year. Most plans will offer some out-of-network coverage, which I highly suggest that we would look into those plans just in case you are traveling. The Advantage plans also cover your prescriptions, as well as dental, vision, hearing, and some fitness benefits, all in one place. So you have one ID card that you show for everywhere. Having a Medicare supplement plan, your A and B of Medicare are your primary insurance. That means you can go to every hospital in the United States and any doctor that accepts Medicare, which is about 90% of all the doctors in the United States. These supplemental plans, like I mentioned, the G and the N plan, those plans are secondary. So there's no additional network of doctors and hospitals have to be involved in other than do they accept Medicare. These plans do not cover any prescription drugs, so we would get you a prescription drug plan as a standalone separate policy. And then you can decide whether you would like to add dental, vision, or hearing benefits. And each of these Medicare plans only cover one person. So if you are a husband and wife and used to having a combination policy where you're both in the same plan under one another, Medicare is slightly different, where you each have your own policy numbers and are under your own plans. Some of the supplemental plans will give you an extra discount if both spouses in one home have the same carrier. Just a reminder that we can also help you find information on dental, vision, and hearing discounts and insurance plans, just so you have that additional coverage that you're used to having. And we also work with final expense and cancer insurance in case you also have that with your company insurance. That's something that you can also have on your own. Some lifestyle and budget items to consider. So the first thing is your cost. So the Medicare supplemental plans do have a monthly premium versus the Advantage plans that might not have a monthly premium, but you have to pay copays every time you use it. So we can help you figure out what is best for you, your situation. Do you have a problem choosing doctors? Do you like to just go wherever you want? Do you just need to make sure that specific doctors are in there and then that's fine? Do you travel often within the United States or have dual residences? That will also depend on what plan you want to get and what plan will suit your needs. You're also going to look at your health. So currently, what is your health history? How is your family's health history? It's something that we do need to plan for because some of these plans do require medical questions after a certain period of time for enrollment. And then there's also a risk level, and this is very personal. So are you okay with paying a certain amount of copays, or would you prefer to know exactly what you're paying out of pocket for the entire year up front? Just to give you an idea of what we can help you with. So we would have probably an initial phone call with you. We're going to gather some information, talk to you about what plan you currently have, what you're looking for in insurance, what's important to you. We take your medications, your doctors, and some of your personal information to help compare options for you. We do full evaluations with you and go over each thing via a video call. We can do like a Teams call like we are today, or we can also just do a plain phone call. We work with multiple carriers, so you're always going to get multiple quotes. We do not just pinpoint you into one specific company, but we do work with A-rated national carriers so that they are large, and it also helps with the distribution of any increases from year to year. We'll let you know when you can change your plans. Annual enrollment is coming up. So everyone in the country that has a prescription drug plan with Medicare or one of those Part C Advantage plans can change their plan between October 15th and December 7th only. If they change their plan during that window, the new plan becomes effective for January 1st, and they'll be locked in for 2026 calendar year. We help with paperwork, enrollments, follow-ups, questions throughout the year. We are going to be your main point of contact in regards to Medicare. And the last line is something I always forget to mention, that this does not personally cost any of you anything out of pocket. This is free of charge to you. It is because you're a part of NFP with your health insurance, and we are able to help you as an employee or even after as you retire. I'm going to pause here. I'm going to leave this up. So this is our Team Medicare information. This is our phone number, and it is also our email. That phone rings to all 7 of our phones. There's people that are here every day, do Medicare all day long. So if you need us, please do not hesitate to ask any questions, send us some information. I will connect you with an advisor in your state, and we'll be able to help review and see how we can help you. So I wanted to open it up now. If anyone has any questions or follow-ups, you can always put it in the chat, or you can feel free to unmute yourself if you would like to ask it.
I had a question.
Sure.
About what you said about the HSA.
Mm-hmm.
So if you're on an HSA, you cannot enroll in any part of Medicare at all?
No, you're not going to want to enroll in A or B, and you cannot apply to start collecting Social Security because that will auto enroll you into A, and you can't get rid of it.
So if you retire and you don't have the insurance anymore through them, but you still have your HSA account that has money in it, at that point you could still apply because you don't actually still on the HSA?
You just can't contribute. So what you're going to do is when you start to decide to retire, and you would call us, my advice to you would be, when we decide to actually do the Medicare applications and start your process, that is when you have to stop contributing to your HSA and tell your company to stop contributing for you. You can still use your HSA money going forward. That's fine. You just can't contribute.
Okay. And what was the thing with Cobra? If you're on Cobra, you're auto enrolled in A and B?
No, you have to have A and B if you're on Cobra.
Have to have it.
Cobra will not work without Medicare if you're eligible for Medicare A and or B.
So it means you'd be paying for Part B and paying for your Cobra.
Correct, which is why it wouldn't make sense. You would definitely do a Medicare plan at that point unless you needed to cover like a spouse or someone for a short period of time.
Gotcha. That makes sense. Okay, great. Thank you.
Absolutely.
I have a question regarding the HSA.
Sure.
If I'm covered under my husband's insurance and he contributes to HSA, does that still apply for me with Medicare?
No. So since your name is not on the HSA and you're technically not personally contributing, you can have Medicare Part A and still be working and still be covered under his plan with the HSA. Since it's his name, though, he cannot have any part of Medicare since he's the one it's in his name.
Now, even though he's contributing, I still get one of the cards with my name on it to use. But if that's still okay. Okay, great.
Yeah, that's okay.
Okay. Thank you.
Of course, absolutely.
Hello. I understood that when you turn 65, so you have 3 months before you turn 65, on the birthday month of when you turn 65, and 3 months after 65. So that would mean that if I have an HSA, so that would mean to me, my understanding that um, my plan was to apply for Medicare when I turned 65, not retiring, of course, and just discontinue the HSA at that time.
I mean, you can do that as well and change plans with the company and not have an HSA so you can enroll in Medicare, but you do not need to do that. So because you're working for a company that has more than 20 employees, you can waive Medicare and stay on your HSA as long as you would like. Or again, we can do exactly what you said and help you enroll in Medicare. You can stop contributing and just use that HSA money going forward.
Now, at what point is there some type of penalty for not enrolling in Medicare?
If you stop working and do not have coverage for over 63 days, that is when penalties will start for everyone who's covered under this current company plan now. There's also other situations, but for you guys, because you do have access to an employer plan, it would be specifically if you just did not enroll in anything and went to retire and had no coverage for 63 days or
Okay,
more.
so, okay, now let's say I did get the Medicare and that, would I still keep the company plan? Okay, so the Medicare plan would only be for hospital type needs, but and admissions, that type of thing. But the B portion would be covered under my current insurance with the company.
So I think, Michelle, that we should talk offline because these are very specific. And I do just want to say, though, it is a personal preference. So technically, you don't have to do anything because when you turn 65, you were under the company's plan.
Okay.
Because it's an HSA, you cannot have A or B. If you decide that you want A or B, then you cannot contribute to HSA. So you'll have to change your medical policy. And you can either terminate your employer plan altogether and get your own Medicare plans, or I would suggest not signing up for Medicare and staying exactly how you are today.
All right. Thanks so much.
Absolutely.
Do we have any other questions at this time?
I have the question about you said would stop working in the 63 days that there's a Medicare penalty. What if you're still working? When does it become a Medicare penalty because you didn't sign up for A or B?
As long as you're working for a company that's over 20 employees, there will be no penalty.
None. Wow, that's very interesting. I didn't know that.
Yes, ma'am.
I heard you keep saying it, but it like didn't click. So then once you're getting ready to retire, then you'd come to you 2 months or 3 months prior to get the Medicare, or at that point it doesn't matter.
Yeah, you would want to do 2 to 3 months prior to you retiring, specifically because it takes up to 8 weeks for the government to process an application.
Okay. And are you auto enrolled in Medicare once you hit 65, even though you don't apply for it?
Only if you're already collecting Social Security prior
Very
to
good. I
65.
gotcha.
That's the only time you'll be auto enrolled.
Very, very interesting. Thank you. That's very helpful. I appreciate it.
Absolutely.
And Michael, I see you have your hand raised if you want to unmute yourself. Michael?
Yes, sorry about that. I
You're
apologize.
good. No worries.
I did it on my headset, but it was still anyway. I'll keep this as brief as possible. How do you get deemed disabled, I guess, is the question. A little background is I had my hip replaced, the top portion, a few years back. I do have lasting pain from it. I use a cane from time to time. I'm interested. I mean, the handicap sticker, just a little I don't know if perks is the right word, but so I could park closer when I'm going grocery shopping, and like, I guess I'm just
To be deemed disabled, you're going to have to apply within Social Security and they'll have to approve you. So it will take medical documentation. You do have to fill that out just directly with Social Security online.
okay.
And your doctor will have to get involved for medical purposes. They usually dive in and make sure that all your medical records match up, and then they'll either approve or deny you, and you can decide to appeal it or not.
Okay. Thank you.
Of course, absolutely.
Um, Anna, did you get your question answered?
No,
chat.
not yet, but thank you.
Of course.
So,
Anna's asking. Oh, so go ahead. Yep, go
Sure,
yeah.
good.
Oh, thank you.
ahead.
So I'm actually asking for a friend, but these penalties, I'm not exactly sure what that is. I'm not aware of that. So what are the penalties? Is it money or what is that
It
in here?
um I feel like I need to know exactly what's going on with your friend to be able to tell you what penalties they may or may not be getting
Well,
or qualify for. Um,
okay, so oh, I was just curious to know, I'm like, do you get charged on a yearly
you
basis if you're
can get
retired?
charged, you cannot get Medicare when you want it. There are different issues that can come into play, but again, that's something that we help you
Okay,
with because we'll ask about your background and your situation
okay.
before we kind of dive into any plan information so that we can get you that information up front.
Okay, so that sounds great. Well, actually, my mom is heading towards retirement in a few years, so that's why I was
Perfect.
asking. My dad is actually already on disability since he was in
Okay.
his early 30s. So I see the paperwork coming through, but half the time I don't even know what it is, but I try to do my best. So this has actually been really, really, really great for me because I did learn a lot. And of course, I'm probably going to reach out at some point, especially for my mom.
Mhm.
So very helpful. Thank
I
you.
Quick question. Your
Yes.
dad is covered under your mom's insurance through the
No,
company?
he's not.
He has
No,
his own? Okay.
he has his own.
Okay.
Yeah, I believe he does have the AB.
Mhm.
And then I'm guessing the D because he does have the medication one. And then he pays, I guess, for Humana. So that would be C. Is that correct? From what I understood?
The supplemental maybe we'll have to
Yes.
see on his card, but I would tell you to reach out to us between
Okay.
October and before December 7th, because that's the time if he's already on a Medicare plan that he can make any changes. So he's
Okay.
kind of
Yeah,
locked
great. Yeah,
into
every
having that
year.
time.
Right. Every year we get a booklet of
Yeah.
any changes and to see what he can kind of dive through and make any changes for. But yeah, no, definitely very, very helpful.
Awesome. Awesome.
um,
Thank you.
and then Amy, did you want to unmute yourself as well?
Yeah, I just wanted to make sure I understood correctly. My husband
Hmm.
actually turned 65 last year, but he still works for a large company.
Okay.
So there's no penalty for him until he stops working, correct?
Yes, as long as the
For
company
A
he
and
works
B.
for is over 20
Yeah.
employees, that's the
Okay.
stipulation. Hmm.
Okay. Just wanted to be sure I understood that correctly.
Absolutely.
Thank you.
Of course.
Lots of good information today. Lots of learning for some of us who aren't as up to date on this. I don't see any more hands raised. I don't see any more questions in the chat. I'll do a last call if anybody has further questions. If not, oh, Katrina, hopefully I said that correctly. If you want to unmute yourself, you can go ahead.
Yes, I just had a question, about if you retire early,
Hmm.
the penalties on that. My husband, he's 59 and he wants to retire at 62. I'm guessing that's the age, I'm assuming. Um,
No, you can't get
no.
Medicare or qualify for Medicare before you turn 65. So this is not going to apply to him unless he gets deemed disabled by Social Security and he is disabled for 24 months or 2 years. So if he retires early, he can do COBRA for a period of time and then he would have to get his own individual policy before transitioning to Medicare at 65.
Okay, so it's best because he's not disabled. He works a really good job. So,
Okay.
but he was just thinking, like you may want to go ahead and retire soon. So,
Absolutely.
he should probably just wait until 65, I guess, and then
I mean, he can at 62. It's just you can't have any of this Medicare or anything until he is qualified for it, which won't be until he turns 65 in this case.
okay. Okay. Thank you so much.
Of course.
All right, and then Estella, and then Abby, and then I think that should wrap it up.
I have a
So,
quick question
yep.
about the Part D coverage.
Sure.
My husband turned 65. He did enroll in Medicare. He's enrolled in A and B.
Mhm.
Is there a penalty if he didn't enroll in the Part D?
Yes. So if you do not have any type of prescription coverage, you will not have a penalty if he is under any type of group in coverage. So for example, if you have him covered under you, he still has credible coverage because of your employer plan. But if he just has A and B and does not have his own prescription coverage, then yes, there is a penalty that he could incur if he goes to enroll in a prescription plan in the future.
What's the time frame for that penalty?
63 days with no prescription coverage.
63 days. Okay.
Yes. And then it's 1% for every month. And that's based on the national average is what the penalty is.
Okay. Okie dokie. Thank you.
Of course.
All right, and then Abby.
I have a question about when you retire either at 65 or you retire at 67. I was told you'll collect more Medicare. Okay, so you're saying yes already.
You're confusing Medicare and Social Security. So you do sign up for Medicare through the Social Security Administration, but collecting Medicare and collecting Social Security and getting Social Security benefits checks have nothing to do with your A and B of Medicare. So you enrolling in A and B and then collecting are going to be two separate decisions that you're making. And they do not, your Medicare will eventually come out of your Social Security, but other than that, that is really the only connection they do have.
I have no idea what you just said. I am sorry. I did not understand.
Okay.
That.
Your Social Security and what you're talking about collecting checks is completely separate from enrolling in Medicare A and B. So Medicare does not change with your age.
I got you. We're talking about insurance as opposed to, never mind.
Benefits.
Oh, Lord,
Yes.
Abby. I got you. I don't know
It's
what I was
okay.
thinking. Once again, okay, it's clear now. Never mind.
No worries.
Isn't it time to go home?
Hopefully soon.
Lots of preparation for when we get ready to retire. So
absolutely
lots of multiple topics to cover. All right, perfect. Okay, good. Oh, Estelle, you had one more question and then we'll wrap it up.
Just a quick question. The 63 days, does it start on the 1st or the end of the month?
The day you lose coverage.
Okay, thank you.
You're welcome.
Bye-bye.
Some of us have some great takeaways for this. Yeah, so much to prepare for. All right, great. So again, we want to thank everybody for participating. We hope it was helpful, some good knowledge to come through. Amanda, NFP, we thank you for your time. Contact information again on the screen. They are available to you. And anyone, it seems as if you know, they can definitely get it in there with you and some additional topics as well. We saw some other coverages. So we will share the recording later this week. And yeah, if you have any other questions, feel free to reach out. I personally can't help you in Medicare, but I can definitely get you to Amanda if necessary. All right, guys. Thank you and enjoy the rest of your day, everybody.
Thank you so much.
everyone.
Bye-bye.
Thank you.